Hi everyone, and welcome back to my Occupational Therapy Doctoral Capstone mini-series. In today's episode, I'll be talking about lumbar pain, lumbopelvic pain, and urinary incontinence. Let's start with an overview of lumbar pain. Lumbar pain is pain in the low back, or the lumbar region of the spine. While many things can cause lumbar pain, for the purposes of today's video, we'll be focusing on pregnancy as one of the main causes of lumbar pain. Throughout the pregnancy process, the body undergoes immense physical and physiological changes. As the belly physically expands, it places excess strain on the musculature of your sides and your back. This can lead to feelings of muscle fatigue and muscle aches. Additionally, as the fetus grows, your center of gravity changes. Typically, the center of gravity is in your core. However, during pregnancy, because there is excess weight in the front half of your body, your center of gravity shifts forward. For your body to accommodate for this, you have to shift how you stand. When you stand up and you are in the later half of the second or your entire third trimester, when you stand up, your back has to be slightly arched to maintain an upright posture because of the weight that is in the front half of your body due to the baby and its supportive structures. Consistent long-term arching of the lower spine and the excess weight that is being placed on the spine can cause muscular fatigue and what feels like a bone-deep ache. After pregnancy, the body is attempting to return to pre-pregnancy functioning. Sometimes, because of the amount of stress and strain that was placed on the muscles of the body, that lumbar pain remains. That is where occupational therapy techniques come into play. Now let's talk lumbopelvic pain. So while there is significant overlap between lumbar and lumbopelvic pain is pain in the lower back with pelvic floor involvement. But what does this really mean? Well, it means that not only are the muscles of the lower back involved, but the muscles of the pelvic floor are also involved or irritated or weakened. This is a model of the female pelvis. We've got the muscles of the pelvic floor at the bottom here. We've got the bladder, the uterus, and the colon in the back. During the process of pregnancy, the uterus expands exponentially and places excess pressure on the bladder and on the muscles of the pelvic floor. Additionally, the birthing process, especially a vaginal birth, places immense pressure on the muscles of the pelvic floor and the superficial muscles of the vaginal canal. Hormones released by the body function to loosen and relax the muscles to prepare for a vaginal childbirth. This can lead to gradual weakening of those muscle systems so that after the baby is born and the birthing process is complete, whether that is vaginal or cesarean, the muscles of the pelvic floor have not only had the excess pressure from the weight of the uterus, fetus, the fluids, and of course the internal organs, but also they have, if you've had a vaginal birth, they have also had the immense pressure of the actual birthing process, of the baby coming through the birthing canal. So lumbopelvic pain can occur when the weakened pelvic floor muscles are irritated and you feel feelings of muscle fatigue, muscle ache, and almost a feeling of heaviness or bulging in your pelvic region. Now, what can we do about this? Well, again, that's where occupational therapy techniques come in. Lastly, but most definitely not least, let's talk about urinary incontinence. During pregnancy, as I mentioned before, the uterus expands and places immense pressure on top of the bladder. If you look at my model here, this is the bladder and this is the uterus. Your uterus sits directly on top of your bladder. As the pregnancy progresses and the uterus gets larger and heavier, it places more and more pressure directly on your bladder, which causes that pretty constant need to urinate. Urinary leakage or urinary incontinence is incredibly common during the pregnancy process for two reasons. One is, as I mentioned, the physical force and weight that is added to the bladder. The second reason is those hormones that relax the muscles to prepare for childbirth. That also relaxes the muscle in the bladder called the urinary sphincter. The urinary sphincter is the little muscle that controls urine flow. So even if you feel the need to urinate, you won't actually release any until you're ready. That is the urinary sphincter. So what can happen is during pregnancy, the hormones that relax the muscles can also relax the urinary sphincter a little bit, as well as, of course, the physical pressure and force that is exerted from the uterus on top of the bladder. Now, after pregnancy, the urinary sphincter and the pelvic floor muscles have just weakened a little bit. Because the muscles of the pelvic floor and the muscles of the bladder are very interconnected, increasing the strength and control of your pelvic floor can help to increase the control of your bladder. How do you strengthen your pelvic floor muscles? The exercises I'm about to demonstrate are impactful for the pelvic floor muscles because you are having to engage them to maintain stability of the movement. You can also do something called a Kegel. Now, a Kegel is an isolated exercise where you engage the muscles of your pelvic floor using your vagina. So the vagina is not only the term for the entire female genitalia, but the vagina is the name for the actual vaginal canal, which is that opening that babies and menstrual cycles come out of. So stay with me here. Imagine that there is a blueberry that you want to pick up using your vagina. It sounds crazy, but imagine it and hear me out. So if this is your pelvic floor, and this is your vaginal canal right here in between these two fingers of mine, and there's a blueberry right here, I want you to squeeze and pull that blueberry up further into your vaginal canal. Hold it for 5, 4, 3, 2, 1, and release. And again, pick up the blueberry. You're really going to feel this if you don't do these regularly. You're going to feel this one. Hold it for 3, 2, 1, and relax. And again, let's pick up that blueberry. 1, 2, 3, 4, 5, and relax. Now, sometimes you are going to feel an increasing urge to use the restroom, and that is because you are activating the muscles that surround the bladder and the urinary sphincter, and so that's okay. But that also does show that there is a correlation between the need and the urge to urinate and urinary leakage with the pelvic floor. So as you're doing these exercises with your pelvic floor, if you have an increased need or urge to urinate, or you do have urine leakage, that does indicate that there is increased need to strengthen and gain control of those weakened pelvic floor muscles. But what I'd like for you to do is have your feet shoulder width apart, tall spine. Instead of having your pelvis tilted forward, I want you to really focus on getting your pelvis in alignment. You're going to feel a difference in your low back. Our normal positioning, we end up in what's called lumbar lordosis, which is an excessive curve of the lower back and spine. So what I want you to do is really focus on getting your hips tilted backwards a little bit so they are in more of a better alignment. From here, I want you to really elongate your body, and I want you to pivot forward at your hips, trying to keep your back straight. You can bend your knees a little bit as you go down. I just want you to find a good spot where you feel a stretch, but you're not straining. And just hold this for 10 to 15 seconds. Slowly, again, trying to keep your spine straight. Come back up. If that is comfortable, keep doing about 10 of those, 10 to 15 of those, again, holding each one for 10 to 15 seconds. If that's not comfortable, if that's kind of exacerbating your pain, then we're going to do just a drop fold. So I want you to, again, keep your pelvic tilted back just a little bit so you are in more of a straight posture. And then I just want you to bend your knees, bend at your hips, go down, and then just curve and let gravity take your arms and just let them hang. You're letting your back just hang. All of your weight is on your feet. You're stable, and you're just going to let yourself kind of hang. This can help to elongate the muscles of your low back if you have chronic tightness in those muscles, and it will allow you to just feel a little bit more loose. If you want, while you're down here, you can kind of go each direction, like you're going to pick up something with your opposite hand towards the floor. This can help to stretch out the muscles on either side of your spine and the muscles of your sides, so your obliques. When you're coming up from this, I want you to come up with your spine first so that you get that flat back, and then come up using your hips. I'd like you to do 10 to 15 reps of that, holding it for 10 to 15 seconds if that's comfortable. If completing these standing is not comfortable, you can complete them seated. You can sit at the edge of the chair and either just fold forward or do that flat back positioning. Another thing to try for spine relief is seated. So sitting on the mat, what I want you to do is have your arms out behind you, elongate your spine, and try to open up your chest. So you're taking a majority of your upper body weight through your arms, and you're elongating your spine. You can sway and shift as you need, but this is taking a little bit of the pressure off of your spine and placing it onto your arms. Another stretch you can do is kind of a wide leg, so your belly can move freely. If you need to, you can have your legs slightly bent. We're just going to reach forward towards our toes. If you can, try to hinge at your hips to keep a flat back. But if this is causing more discomfort, you can roll into it. Hold this for about 10 to 15 seconds and come back up. The next one is called cat-cow. This, I would like you on all fours. I would like your knees hip width apart and your arms shoulder width apart. From here, I want you to have your back as flat as possible. And then as you inhale, I want you to arch your back and look up. And then as you exhale, you're going to bend your spine into a C shape as best as you can and look down. Inhale up, exhale down. Inhale up, exhale down. Back to neutral, so that flat back. And you're just going to, from here, maintaining your knees at that same hip width apart, you're just going to sink back onto your knees, and you're going to bring your hands out in front of you. What this is doing, this is stretching your spine. Hold this for 10, 20, or 30 seconds, depending on how you feel. And then come back up to that tabletop position. Now, if hip width is not comfortable, you can go ahead and bring your hips a little bit wider so your knees are farther apart. so that your legs are not in the way of your belly. These next exercises are designed to target strengthening the lower back as well as strengthening the pelvic floor muscles. So these exercises are good for not only lower back pain, but also lumbopelvic pain and urinary incontinence. If you do have urinary leakage with movement, I would recommend preparing a little bit for this one. That could be going to the restroom and completely voiding the bladder, or putting a panty liner or a pad on just in case there is some leakage during this process. Now, there is no shame with leakage. It's not a personal failing. It's just muscle weakness. For the first exercise, I would like for us to be on the mat. We're going to be lying on our back with our knees bent. So when you're on the mat, most people have at least a little bit of distance between where their back is and where the mat is. For me, I have about half an inch of distance. And what this exercise is going to do is it's going to allow us to tilt our pelvis back, engage our core, and touch our back to the mat. This functions to not only strengthen our core, you have to engage your pelvic floor in order to get it to tilt effectively. And this is taking strain and stress off of our lower back muscles and just allowing them to rest while other parts of our body are more engaged. From rest, I really want you to engage your core, and part of that is going to be engaging your pelvic floor by essentially trying to pick up your pelvic floor and bring it in towards your core. So you're going to tilt your pelvis, pick up your pelvic floor. You're going to really feel it. You're going to feel some muscle contractions, and that's not a bad thing. That's actually what we want. So I want you to really engage your core here. Take that strain off of your lower back so that your back is flat against the mat. And you're going to hold this for about 10 to 15 seconds. Now what this is doing is it's not only taking the stress and strain off of your lower back muscles, it is also engaging your core and your pelvic floor muscles, which is building up those compensatory core muscles to allow for a more upright spine position when you're standing and sitting, as well as engaging the pelvic floor to strengthen and really use those pelvic floor muscles. Doing about 10 to 15 of these, holding each for 10 to 15 seconds, can be really nice as not only a relief for your lower back, but again, strengthening your core and your pelvic floor muscles. The next exercise, we're going to start again on our back with our knees bent. We're going to go into a glute bridge. So I need your knees pretty significantly bent. So when you go upright, you have a straight triangular shape. Now, before we get started, so what I see often and is incorrect is you just go up and you hold. Now, this is putting strain on my back right now because my back is very arched. My glutes are engaged, my core is not really engaged, my pelvic floor is engaged, but I'm not in that posterior tilt, so that's putting a lot of strain on my back. Now, if I go into that pelvic tilt so my back is flat against the mat, I engage my core, I engage my pelvic floor, I engage my glutes, and I raise up. This is so much better on my back. I don't feel any strain on my back because the other parts of my body are using that compensatory musculature to allow for my back to be more flat and not have to work so hard to go into a glute bridge. Now, doing between 10 to 15 glute bridges is effective, again, to not only take some of the strain off of your spine, but also to strengthen your core and your pelvic floor. It also has the added benefit of being a nice glute workout as well as a nice quad workout. Next up, we've got squats. So in order to do a proper squat, I need our feet about shoulder width apart, so a little bit wider than your hips. You need your knees a little bit bent, and we're pivoting at our hips so that we can get into a proper posture. So it's like you're about to sit down. From the side, it looks a bit like this. Bending at your knees, flat back, arms out to counterbalance, and we're squatting. Try to keep your knees in line with your toes to avoid being too far forward or too far back. And in order to do a squat that is effective, engage the muscles of your core, your pelvic floor, your back, your glutes, and your legs. Arms out to counterbalance, and go down and come back up. Thank you so much for joining me today. I hope you enjoyed this episode and learned something useful. I'll see you next time. Bye-bye.